For the last 3 or 4 years, March has been designated the Colon Cancer Awareness Month. And this is a month for the medical community to focus on colon cancer. Colon cancer is the third most common cancer in the United States. It's the second most common cancer in terms of cause of death. And what's amazing is it's largely preventable if patients get themselves screened appropriately.
I just think it's critically important that people are screened for colorectal cancer, and there's an excellent screening tool. Most often a colonoscopy is used.
Everyone over the age of 50 ought to have a screening colonoscopy.
Because colon cancer is nasty, especially when it gets to become symptomatic, it's usually too late. So you need to get in there 50 years old if you're at normal risk, if you have risk factors such as family history of colon cancer, family history of colon polyps, even female gynecologic cancers such as breast cancer, cervical cancer. Those increase your risk of developing colon cancer. So you need to be more aware that, okay, maybe I do need to get in to get that colonoscopy done.
The emphasis this month, of course, should be on screening. If you haven't had screening, or you were encouraged to have a second colonoscopy and the time has passed for that, to get in and take a look and try to get ahead of it, because once the surgeons get involved, it becomes a much more complicated affair, and it's ideal to deal with it when it can still be addressed with a scope, endoscopically, with a colonoscopy. All those terms are synonymous, but that's the ideal time to manage a polyp.